Hey, I'm Dr. Kelly Vaughn with First Choice Dental Centers and Restore 24 Dental Implants. Today we're going to be discussing sinus lifts and why you might need one. A sinus lift is a procedure that is sometimes necessary before placing a dental implant in the upper jaw, specifically in the back near where the molars and premolars are, or your chewing teeth, because this area is very closely related to the sinus cavity. And the sinus cavity is an air-filled space, basically like a balloon, above your teeth. Now, here's why someone might need a sinus lift and how it affects cost and the healing process for dental implants. So why would you need a sinus lift? Sometimes the sinus cavity might be too close to where the implant needs to go. And placing the implant without enough bone could risk damaging the sinus itself or causing the implant to fail. Now, a sinus lift solves this by adding bone, usually just under it, to lift it up out of the way and provide enough bone to hold the implant. So what might lead to the need for a sinus lift? Well, insufficient bone height or, like I said, the sinuses are just too close to where you want to put the implant. Now, this could just be because that's your natural anatomy. Some people have big sinuses that are really close to the tooth roots, or even sometimes dropping in between the tooth roots. Now, you can see in this image, I've traced the sinus floor with red. If one of these premolar teeth were removed, we'd want to lift the sinus to make room for the implant because it's just too low. And sometimes a sinus lift is needed because of bone loss due to missing teeth. Because when you lose a tooth, there's nothing to stimulate the bone in that area, and your jawbone basically melts away and has to be built back up to accommodate the implant. Now, how does a sinus lift affect healing time for dental implants? A sinus lift can add about 6 months to the overall timeline of getting a dental implant. This time allows the bone to heal and fill in properly, creating a nice dense area of bone for the dental implant. The bone graft material we use acts as a scaffold, and your body fills it in with new bone growth during that healing time. Now, the bottom part of the sinus or the sinus floor, it's just lifted up. We aren't going into your sinus. We're just lifting it up out of the way from the area where we want to place the implant, and then we put the bone graft in and release the sinus floor. So now it's resting higher than it was. Then over the next few months, your body is filling in the voids of that bone graft scaffolding. And then once healed, there's a nice dense area of bone and the dental implant can be placed. How does a sinus lift affect the cost of dental implants? A sinus lift increases the total cost of getting a dental implant because it's an additional procedure. The lift itself can cost anywhere from $1,500 to $5,000, depending on the complexity, the amount of bone that needs to be added, and it varies depending on where you're located in the world. So just to summarize, a sinus lift is necessary when the upper jaw doesn't have enough bone to support a dental implant. It adds extra time and cost to the overall implant procedure, but it is important to ensure that your implant is secure and successful in the long term. So if you're in need of a dental implant in the upper back jaw and you find you need a sinus lift, don't be discouraged. It's what's best for the long-term success of your new implant. I hope you found this video helpful, and I look forward to seeing you again soon.